Hi, my name's Mark Lancaster, and I've been asked by the hospital to talk to you about my experiences in the endoscopy unit at St James's. I'm a bit unusual in some respects as to my reasons for being at the endoscopy unit. I drank caustic soda when I was a child and I burnt my throat quite badly, and over the years I've had quite a few operations, so in that time I've visited quite a few endoscopy units right across Yorkshire. The reason I ended up at St James's was purely down to getting a wee bit older, and by getting older I found that things weren't as elastic as they used to be, and the scar tissues that were building up were preventing me from actually swallowing. So I had a few emergency operations in York and Harrogate, and then I was referred to St James's. Purely and simply because they had the best tools and the best people to be able to help me with my particular problem. And what they actually needed to do was dilate my esophagus, and they did so on many occasions over the course of 18 months. One of the reasons that I was sent here is because it is a regional area of speciality, and this seems to be a move that the NHS are moving further and further towards. It's a little bit daunting in the first instance, having to travel quite a long way to a central hospital, but by doing so I think I received some rather good quality care, and I'm now able to eat and drink fairly normally. But on entering the actual unit, the endoscopy unit's not exactly well signposted in the hospital, so it's a good idea before you get here to make sure you actually know where it is, because it's stuck away in a far corner of the hospital and people wander around aimlessly. So when you arrive at the hospital, there's always lots of people to help you. So if you ask anybody at the reception, they'll tell you how to get there. You get into the unit and you're greeted, you hand over your details, and you take a seat in the reception area. Now, some people find it quite helpful at that point to take a friend or a relative with them to just see them through the time whilst they're in the unit, because it can be quite stressful. But one of the things that I found, and especially at one particular stage, I hadn't eaten or drunk properly for 5 days, and although it's nice to have relatives there, it would be nice if you asked them not to bring any food into the department, because it is really, really, really hard work watching somebody try and unwrap a Mars bar when you haven't eaten for days. Many people have to fast before they undertake any procedure, so it's just good manners, really. It can seem a little bit alien once you're in there. There's a lot of activity, although the team try and keep it as serene as they possibly can. But first of all, you'll be taken by one of the nurses for a pre-assessment. They will look through all of your notes, they'll probably check your weight, check your blood pressure, and explain a little bit more about the procedure and what's actually going to happen during the day. At that point, you'll probably be taken back to the reception area, or perhaps to another waiting area where you may need to wait a short amount of time for your specialist to come and get you. You'll be escorted to one of the rooms where your procedure will take place. After that, as far as I was concerned, it was a wee bit fuzzy. I woke up in recovery, and I was looked after there. And again, most patients will spend a little bit of time in recovery, depending on what medication you've had. Once you've passed through recovery, they will assess you maybe for another hour or so, and then you'll be escorted back down to your relatives in the reception area. And at that point, hopefully, you're free to go. If I was asked for my top tips, if I was to be in the endoscopy unit, or any unit I suppose in the hospital, is you've got to be patient. Things happen around you for reasons. Things don't always go to plan. Some procedures take longer than others, and you may feel from time to time that people are jumping a queue, and I've seen this happen many times as I've sat there in the waiting area. But some rooms move faster than others, and there are obviously from time to time situations which are out of control of the team that are running that room. So you do need to be a bit patient. Make sure you take a book or a magazine, it's vital. And if you are going to be here for any particular length of time for any other procedures as well, it's a good opportunity to get to know the team who are part of your well-being and recovery. Everybody who works in the endoscopy unit has your best interests at heart, and they really do work hard. I cannot say I know how much time and effort they spent on looking after me, and I see that reflected in the care that they give to others. And from my unique perspective, it gives me that opportunity to say that without the people who look after and care for us within the unit, things would be very different.